Hi everyone, my name is Rommel Ebio. Today, I'm going to do critiquing articles regarding one of the most fast growing and most misunderstood areas in healthcare today: medical cannabis. Medical cannabis has moved from being a stigmatized, illegal substance to becoming a legitimate medical product. But that transition is not simple. Around the world, people are still struggling with three big challenges. Number one, the science is incomplete. Number two, the laws are inconsistent. And number three, the stigma is still very strong. Here on screen are the list of articles reviewed, and each one will help us understand how medical cannabis can move forward. Each one looks at different parts of the puzzle: science, safety, and marketing and policy. Together, they show that medical cannabis success depends on three things working together: solid scientific evidence, smart marketing strategies, and clear public safety policies. So, what do we know so far about the science behind medical cannabis? To understand this, let's first look at what we call the product truth. Studies by Bukoska and Patel in 2024 explained how cannabis works in the body. They showed that cannabinoids like the so called CBD and THC have strong anti inflammatory and antioxidant effects. CBD may even reduce the risk of infections in some cases. And in cancer care, cannabis helps with nausea, pain, and improves appetite. But both studies also point out an important issue. The biology is very complex, and clinical evidence is still limited, with studies not proven in humans yet. So the message is very clear: medical cannabis has real medical potential, but the science is not complete. This is where Entice et al. Enter the picture. Their interviews with pharmaceutical marketing managers reveal a consistent worry that the science is promising, but not strong enough to support big claims yet. Managers describe medical cannabis as being on the verge of becoming a respected therapeutic product. But they also admitted that without more studies, building a confident, trustworthy brand is extremely difficult. Doctors, insurers, and regulators all needed clear evidence before fully endorsing medical cannabis. And that is why brand identity in medical cannabis marketing is crucial. It's important to differentiate medical from recreational cannabis to gain acceptance from healthcare professionals and conservative patients. However, a study by Al Halam and Barakat in 2025 indicates that markets for both types are interconnected. Marketers face a paradox of needing to distance themselves from recreational use while benefiting from its public image. The recommended approach is to promote medical cannabis as a safer alternative that reduces harm, thus enhancing the brand without relying on recreational identity. So the solution is harm reducing message or harm reduction message. So data from Al Hala and Barakat found that as medical cannabis sales rise, tobacco use tends to fall. This suggests people may be using cannabis as a healthier alternative. Patel et al. Also noted that cannabis can help reduce opioid doses, potentially lowering dependence and overdose risk. Medical cannabis is a safer alternative that reduces harm, and this strengthens the brand without relying on the recreational identity. Okay, so far we've talked about science and marketing, but there's another major issue that can derail everything, and that's safety in workplace. While marketing focuses on access and acceptance, Lee et al. Draw attention to a more and major practical issue, which is disability. Their study of chronic pain patients found that one in three use cannabis while working. Even more worrying is that people with physically demanding or dangerous jobs like construction workers, repair technicians, and machine operators all reported even higher rates. So, why is this a serious industry risk? If medical cannabis becomes more widely prescribed, but workplace safety regulations do not evolve, accidents are almost inevitable. A single high profile incident involving a medicated worker could spark strict regulation or public backlash, undoing years of progress in acceptance. So, what do we do? Marketing must include safety messaging, not as fine print, but as part of the brand, like use responsibly, don't operate machinery while impaired. Number two, policymakers must update workplace laws. Right now, many companies use zero tolerance drug tests, but cannabis stays in the body long after impairment is gone. So that means patients who are not impaired can still fail a test. Instead, instead of testing of cannabis presence, we need tests that measure actual impairment, similar to alcohol breath tests. And number three, innovate safer products. Bokosca already highlighted that CBD is non psychoactive. So companies can market CBD dominant products for people who need to function at work. So, based on all five studies, here are the practical policy steps. Number one, standardize medical cannabis because there are different strains and extracts that are vary widely. So, for doctors to trust cannabis, government must require consistent, measurable doses at high quality manufacturing standards. Number two, use cannabis tax revenue to fund clinical trials. Al Halam and Barakat found that medical cannabis sales increased by about 26 tons per year in countries that legalize. So part of that revenue should go directly to research, exactly what the pharmaceutical managers say that they need. And number three, modernize occupational safety laws. Policy must focus on impairment, not just stage detection. And public health campaigns should warn heavy users. So, in summary, medical cannabis is evolving, but its future depends on connecting three worlds: science, marketing strategy, and smart policy, public policy. As the research shows, none of these areas can work alone. Medical cannabis will only reach its full potential if scientists, policymakers, and industry leaders move forward together with transparency, responsibility, and long term vision. Thank you so much for listening.